Hello, everyone. Whew, had a longer weekend than we expected. Thanks to Ida. No thanks to Ida. Today is Tuesday, August 31st, the last day in August. Seems crazy that tomorrow is September. 2021 is just flying by. I'm Rendy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department, to give you our 2:30 daily update of the impact of the COVID-19 pandemic on Mobile. Cumulative number of cases reported is at 63,701. 406 cases were added yesterday. Ironically, that's also exactly the same number of people who were in hospitals yesterday with COVID-19. So, as we discussed, the number of cases is going down slightly. The number of hospitalizations is going down slightly, although we are still seeing record numbers of hospitalizations. No additional deaths were reported to us yesterday, but 1,034 have died with COVID-19. I'm going to talk a little bit more about deaths in a sec. And the cumulative number of people hospitalized with COVID-19 is at 7,867. 51 new admissions were recorded yesterday. It could be that they were newly admitted with COVID or that they've been in the hospital and then they were just newly diagnosed with COVID, but 51 additional yesterday. We published our weekly report today, a day late since our agency was closed to the public to keep our patients and employees safe from the effects of Hurricane Ida yesterday. Just a couple of comments from the expanded weekly report. So the number of cases reported last week was down slightly from the week before. That's good news that for 2 weeks in a row we've had slight reductions in the number of cases reported to us. So we still have our weekly report goes through August 28th, so not the entire month of August, but nearly. So we can see that in August we will have around 15,000 cases of COVID reported in the month of August alone, and that is double what we saw in January. Just an extraordinary number of cases. We're starting to see the moving average number of patients hospitalized with COVID go down. The moving average of new hospital admissions is also trending down. The percent of emergency department visits for COVID-like illness is down slightly, but again, super high. What I'm really disappointed with right now and very sad about is the number of deaths that have been recorded for August. We know that the deaths lag behind cases and hospitalizations, but I had really hoped that the number of deaths would remain low since we have such high vaccination rates in people who are over the age of 65. But if you look at our expanded report and if you look at the chart that's here posted over my left shoulder, you can see that for August we've had 102 deaths reported. In July, 84. In June, when things were looking so good, we only had 9 COVID deaths reported for the entire month of June in Mobile County residents. And we have seen 8 to 10 times the number of deaths recorded in July and August. And this is just a very unfortunate situation where we know what kept deaths low: vaccination, wearing a mask, distancing to keep the number of cases down. There really is it's very sad and really no reason to see such high numbers of deaths in our community right now. So again, 84 deaths recorded in July and 102 so far in August. It makes me really sad for our community that we're still we're losing so many people to COVID again. And we are still seeing deaths in those older populations, but we're seeing more deaths in the younger pops, the ones that aren't vaccinated, the ones, we still have 85% of people in the hospital are unvaccinated, and the overwhelming majority, over 90% of our deaths are occurring in unvaccinated people. And again, that is the purpose of the COVID vaccine, is to keep illness less severe for people who do get COVID, to prevent hospitalization and deaths from COVID-19. The vaccines are very good, again, to prevent hospitalizations and deaths, and are quite safe, as we've shown over and over again by looking at studies that have gone on around the U.S. and the real world setting of putting the vaccine to use. Our percent positive is still very high. I think the state percent positive is 22%. Mobile County last week was at 23% test positive. Those still really high percent positives. So it's going to take quite a long time, many more weeks, maybe even 2 months before we have any chance at getting back down to low COVID transmission like we saw in June. A lot of people ask, what about the hurricane? How is that going to affect COVID? I mean, last year, granted, we were more affected last year, but usually when people are picking up sticks in their yard and recovering, and maybe they're out of work, going to get tested for COVID is not high on their list of things to do. But we do worry about, families coming, evacuating here, shelters being open, that those things make it, create a higher risk situation for COVID transmission. But we'll see. I expect we'll probably have a slight dip because of the hurricane, and then it will start to go back up. And since we are, right here on the cusp of Labor Day weekend, many more football games this weekend, the weather's supposed to be really nice. I expect that we may see a small dip, but it's probably going to go up. And that's just super unfortunate because, again, we know what slows transmission. A couple things just wanted to mention. We still are vaccinating and testing at the Mobile County Health Department on a weekly basis. I have a little scratch note here just to let you know that even though our clinics closed on the weekend, so we did not give COVID vaccines or test people for COVID on Saturday or Sunday or Monday, last week the health department administered 1,941 vaccines. Just over half of those were third doses, and we tested 2,749 people at our 2 walk-in clinics with about a 15% positive rate. So talking about a third dose, if you came to any of our clinics today and you're there to get a third dose of vaccine, you will be asked to attest that you are eligible for the third dose. The state health department developed this form. It's quite clear. So we are falling in line as we normally do and asking people to attest that they meet the criteria outlined by CDC for a third dose of mRNA vaccine, either Pfizer or Moderna, at least 28 days after your second dose of that series. So again, if you got Pfizer, you should get a third dose of Pfizer. If you got Moderna, you should get a third dose of Moderna, not sooner than 28 days after your second dose. So here's what you're going to be asked to attest to. You just check the box. We don't ask you to tell us which of the bullets you fall into. We don't ask for physician records. You can talk to your provider about it, your personal physician, but you don't have to bring a note or anything. If you check the box and sign and date, then we will give you a third dose. It says, I attest that I am immunocompromised and am eligible for a third dose of vaccine based on the criteria below. And there are 6 bullets. Receiving active cancer treatment for tumors or cancers of the blood, received an organ transplant and am taking medicine to suppress my immune system, received a stem cell transplant within the last 2 years, or taking medicine to suppress my immune system, moderate or severe primary immunodeficiency, advanced or untreated HIV infection, active treatment with high-dose corticosteroids or other drugs that suppress my immune system. So again, if you can attest by your signature and date that you fit one of those categories, we are very happy to give you your third dose as long as it's been at least 28 days since your second dose. Or another thing I wanted to mention, the Centers for Disease Control publishes lots of information about the safety of the vaccine, about how masks can help control outbreaks and slow transmission. I mean, all kinds of things. And I just wanted to share one with you today that shows that during March 2020 through January of 2021, so 10 months of data collection, and this is using hospital-based administrative data across the United States, they found out that there is an association, and a really strong association, between having COVID illness and myocarditis. So patients with COVID-19 had nearly 16 times the risk of myocarditis compared with patients that did not have COVID-19. And the risks vary some, of course, by sex and age. Again, I receive sometimes when I say, are you going to get vaccinated? No, younger males, the vaccine sometimes associated with a risk of myocarditis, and that there is some sort of connection there. But that risk of myocarditis from vaccination is far less than the risk of myocarditis as a result of having COVID-19. So again, patients 16 times the risk of myocarditis compared to people who did not have COVID-19. All right. There are just a few questions today. That's quite nice. All right. Someone asking about boosters, specifically about a J&J booster. So the manufacturer, Johnson & Johnson, the manufacturers of that vaccine, did come out and say they thought a third booster, a booster dose, I'll get this straight in a minute. Yeah, so for Johnson & Johnson, remember that's a one and done vaccine. So for Johnson & Johnson, a booster dose would be a single vaccine. And the manufacturers have said that will likely boost immunity for some people, but so far, booster doses of any kind are not FDA authorized or approved. So stay tuned for what FDA and CDC decide about the value of a booster dose. Someone asking about an antibody test to see if you've developed antibodies after vaccination. Where do you find it? There are some over-the-counter tests for measuring anti-COVID antibodies, but honestly, trying to interpret the results is not straightforward, and it could be more confusing than informational. It's not just antibodies that contribute to your immune response. You could potentially have antibodies from a previous infection, and we know that it's the immune response after vaccine that help. So far, CDC and FDA are recommending against an antibody test to see if you have full protection of COVID, because we just don't know. Some of them are positive minuses. Some of them have a scale of antibodies. It's just not clear right now. And then a question about some treatment that's being used in a detention center, which I have not heard this rumor, so I will not comment on it. So I believe that is all for today. Mark Bryant and I, our communications director, and I are going to be out Thursday and Friday. I'm not sure if someone will take our place doing Facebook Live. It depends. We have a couple of staff outages, so it may be that today and tomorrow is our Facebook update for this week. We're just not sure yet, but we will definitely be sharing the daily report. We'll be updating our COVID dashboards, and again, stay tuned to social media for updates. Post your questions there, and we'll do what we can to get the information out to you. So hope everyone stayed safe and rode the storm out with Ida. I think that we were, for the most part, except for the tornado and some flooding, I think we were spared the worst of it, and our hearts and thoughts and prayers go out to all of our colleagues in Mississippi and Louisiana who are starting to recover from the effects of Ida. And remember, anytime you're outside of your house, please wear your mask and distance, particularly if you're indoors in areas that, where there are people that don't live with you and you don't know their vaccine status, and get vaccinated. It's never too late to get a safe and effective COVID vaccine. So we'll talk again tomorrow, and everybody have a great week.